this webinar, I'll try to break down some of the concepts that I'm sure my esteemed colleagues are going to walk you through for the rest of the day. I am a translational researcher, so I work in the lab. I have a lab at Mount Sinai, and my lab is really interested in understanding the biology of lung cancer so that we can have better therapies, and we can also choose patients who will best fit that therapy. So with that in mind, my talk is about bench to bedside. What I thought I would do today is really go to the basics of what is cancer research, what does bench to bedside even mean? What is DNA, RNA, and protein? What is in vitro and in vivo characterization? When you pick up a paper and you read about in vitro and in vivo, what does that really mean? And what are these high throughput technologies and analysis tools that has helped us understand so much about cancer in general, and of course, lung cancer, which is our topic of discussion today. And then I'll touch upon a little bit about the discoveries from the Sen Lab. This will be mainly towards small cell lung cancer and also non-small cell lung cancer. So with that, let's get started. So what is cancer? So cancer, I think, we have to acknowledge that it is a very, very complex and heterogeneous disease. It is characterized by the development of the normal cells in the body that divide uncontrollably and they refuse to die. So it's really your normal cells that refuse to die. And the cancer cells have the ability to infiltrate and destroy normal tissue. And that's what makes them so fatal and leads to the morbidity and mortality for this cancer. And to make matters worse, cancer often has the ability to spread to other parts of the body through the blood or the lymphatic vessels. And this is what we call metastasis. So just, thinking about cancer, and that's why the cancer research takes so long, is because it's a complex disease. It's not one disease, and every patient is actually very different from the other. So there is a long time span of what we consider drug discovery and development pipeline. It often takes anywhere between 8 to 20 years. And it starts with these processes of identifying a good target and then having, let me see if I can never mind. It starts with a target identification. It goes to, having target assays and constructing your best sort of targets. And then we go to validation of these targets, and then it goes to the clinical phase. My work and sort of the talk for today will concentrate mainly on what happens before we go into the clinical setting and the validation of these targets, which often takes years. 2 to 5 years is the lifespan of what we can spend in the lab in order to really come up with a very good target and take it to the clinic. So what is cancer research? I told you about cancer, but what is cancer research? Cancer research is also quite complex, where different components come together. So the basic research, which we do in the lab with cell lines, with mouse models, and then translational research is when we try to take this finding of the biology from the lab to the clinic. Clinical research is when you take human tissue and other things from the clinic, and then you try to study biomarkers and other things. And then population research is to understand more epidemiology, the risk factors that predispose a certain individual towards a cancer risk. So these are all very important components of cancer research. What my work has mainly concentrated on is basic research and translational research. And why do we need cancer research? I think drug discovery, not only is it a very lengthy process, it's also a very expensive process. And this is a study which kind of talked about, what is the degree of success when you go to a phase 1 or a phase 2 clinical trial, a phase 2 or a phase 3, and then phase 3 to approval. And you will see that depending upon, what disease you are in, oncology is right at the very beginning, the degree of can be quite low, right? Because we have to develop efficient tools, we have to come up with the speed, we have to come up with reliable targets, we have to be efficient, and we have to choose the best patient for the best drug. So in order to make this process as efficient, reliable, and speedy, we need cancer research. We need to learn what we understand about the biology in order to ensure success in the clinic. So the goal is to move basic science discoveries more quickly and more efficiently into practice. And that is why cancer research is sort of our true north, which we have to do in order to have more effective therapies in the clinic. And where we are today is a true testament of what cancer research can do, because cancer research has accelerated lung cancer drug discovery and approval process. And this is a picture from the Lung Cancer Foundation of America website, Lung Cancer Research Foundation website. And as you can see, going back from the early 90s, now we are at the 2020s, we have seen in leaps and bounds, where we are at with the approvals and with pushing drugs from the clinic, from the lab to the clinic. So the targeted therapies, immunotherapy, chemotherapy, we are at a really exciting time of cancer research where we are seeing real movements in the clinic. And I think for the longest time, we couldn't associate lung cancer with long-term survivors. And now we are seeing long-term survivors in lung cancer. So I think thanks to cancer research, which has really accelerated this drug discovery and approval process.